Hi, I'm Colin Hung with Healthcare IT Today, and I'm here with Dr. Befera, CEO and founder of Scanslated. Dr. Befera, welcome to the program.
Thank you, Colin.
Tell us a little bit more about what Scanslated does.
And of course, so Scanslated is software that transforms the radiology report into a patient-friendly, interactive format. So we take the standard radiology report that the radiologist has written, really intended for other doctors, and we transform it into a version that the patient can understand and really have access to the terminology and take action on.
Sounds like you're really making the radiology report less confusing.
That's right. That is our mission, is to really empower the patient with a report that they can understand, utilize, something that gives them access to this language that is often impenetrable for patients, is technical medical language. And we're trying to make that something the patient can really engage with and allow them to feel like they're more engaged, more empowered to be part of the healthcare process alongside their doctors, and also to improve the doctor-patient interactions.
So Dr. Befera, can you explain how are your reports delivered to patients?
Sure, so if possible, we like to be where the patient is already finding their report. So we integrate with existing patient portals. So the patient logs into the portal like they usually do, they find the radiology results, and they generate the patient-friendly report right there. So it's a very streamlined experience. For customers or clients that don't have a patient portal, we can deliver the report directly. So sending the patient a unique link to their phone or their email that the patient can use to just generate the report on any device.
And can you give me an example of some of the terms that you help patients understand better on these radiology reports?
Sure, so radiology reports are full of all kinds of complex medical terminology. An example from a CT scan of the abdomen, there's something that's commonly used by radiologists is there's no focal hepatic lesion. Well, to me as a radiologist, I know what that means, but to a patient it's confusing. They might start Googling terms. You can easily go down a rabbit hole, and it causes anxiety rather than making the patient feel empowered. So, in a Scanslated report, the patient can click or tap on that phrase, no focal hepatic lesion, and they see an explanation that's written by a board-certified radiologist. So that example, the explanation is, no spots or growths are seen in the liver, this is normal, and just lets the patient easily understand exactly what the radiologist meant there and then move on.
Right, so you're giving a lot of comfort actually to the patient, because now they're not as worried about reading some of these rather complicated medical terms.
That's right, so our goal is to really demystify this language and to take language that's really only meant for doctors and make it accessible to the patient. And so that's really what our goal with all of the explanations that we write.
And you're a practicing radiologist, so you definitely are familiar and up to speed with all these terms, of course.
Yes, I'm a practicing radiologist. And all of our content in our content library is written by board-certified radiologists, and it's written specifically for a patient audience, so specifically for this purpose. For a patient who's reading a radiology report, what would we want them to understand when they're looking at this language?
And Dr. Befera, why is this important to have now? Like, why should a healthcare organization consider implementing Scanslated right now?
Well, the market is competitive. I think that anything that can help a hospital or imaging center differentiate and show the patient that, hey, we care about you, is needed right now. Another reason I think it's important for hospitals and health systems to be thinking about this now is that the government has passed the Cures Act, the 21st Century Cures Act, which requires that all information in the medical record be made available immediately. So now not only are patients accessing their health information, but they're accessing it very early, often before they've had a chance to talk with their doctor. And so instead of helping the patient feel engaged, when they don't understand the reports, they can feel confused and anxious. And so it's not accomplishing the goal that we have when we're providing access in the first place.
So Dr. Befera, where can people go to find more information about Scanslated?
Sure, they can visit our website, scanslated.com. We have a lot of great resources there, and you can see examples of the product in action. And we have some sample reports, so people can click through a report just like a patient, see what the patient experience is like.
And then it's Scanslated, it's with an SLATED at the end, .com.
That's right, it's Scanslated, it's translated with a scan in the front.
Well, Dr. Befera, thank you for being on our program today. Really appreciate the information you shared.
Thanks, Colin.
This has been Colin Hung with Healthcare IT Today. Thanks for being here.